Hello, my name is Kelly Gable, and I'm a psychiatric pharmacist and a professor at SIUE School of Pharmacy. And I'm joined today with my colleague.
Hi, I'm Julie Blanco. I am a social worker and I'm the director of training at Illume, the Behavioral Center of Excellence. And we are part of Places for People. So I'm very happy to be here. Thank you.
We are excited to talk about vaccine hesitancy and vaccine hesitancy specifically, and ways that we can intertwine communication, specifically motivational interviewing, in hopefully helping you to have conversations with a little bit more ease, especially whenever they're a bit more challenging. So we hope that this is a brief overview, and there's lots more that we could learn, but we wanted to give you some tips and tricks along the way as you start to navigate these conversations more and more over the next few months. So our hope is in this brief time together that we are going to talk about practical communication strategies, and we're going to do this specific to COVID-19 vaccine hesitancy. We're going to talk about the spirit of MI just a little bit. We're going to interweave some skills that we think are important in your conversations. And our real hope is that in this process of being mindful of your communication style, we want to instill hope and build trust back into our communities so we can all heal as we're navigating the end of this pandemic.
For folks who are a little familiar with motivational interviewing, you might know that it's a tool, a communication style that you can use that's really helpful in helping people move toward positive change in their life. And so one of the things we want to make sure people understand first what it's not, right? And it's not a way of tricking people. It's not a way of kind of getting people in a sneaky way to do what you want them to do while you're being nice to them. It is different than a decisional balance of, exploring all the pros and cons. And it is sometimes challenging to think about how you're going to go about it and, how you're going to support your person and stay true to yourself. So it's not always easy to do. One of the things they say is that it seems simple, but it's not easy, and that it is not always going to get you where you're hoping that person goes. Sometimes you're going to do a great job, and the person is still going to say, "Yeah, not right now, thanks." So.
And I think, in following what Julie said, giving yourself some grace that these conversations aren't always easy and easy to navigate. And so letting yourself, it's okay if you don't always get it right all the time. And so I really think this is an important slide. And so be mindful, be thinking about these as we go into the next part of our talk. The big part of MI as we are exploring different ways of communication is the focus on ambivalence. And so MI is really the critical part of this is identifying the ambivalence. And with vaccine hesitancy, it's do I get the vaccine or do I not? Or when do I get it? And so, at the core of ambivalence is this feeling of, I don't know which side to go on. And of course, ambivalence runs through in all aspects of life. We can all think about things that we feel ambivalent about. We want to do something, but we don't. We try, but we can't. And this is normal, for lack of a better way to describe it. It's not pathological. It's a normal part of change process. And yet it's the part that keeps people stuck. And so in our exploration, when we're talking to someone about vaccine hesitancy, this is where we want to be thinking in our own heads, what's the ambivalence here? Where are they at in their readiness for some sort of change when it comes to moving forward with a decision? And so this scenario is where we want you to kind of mentally place yourself. Imagine that you are providing education in the way that you would do it, whether it's on the phone or in person. You're talking to someone about receiving the COVID-19 vaccine. It's just opened up for them to be able to get it. You're thrilled to give them a call. And this person says, I won't get the vaccine. I've heard about people getting COVID after they get the shot. And so what we want you to think about here is, what would your natural response be? If you heard someone say this, where would you go with this? And imagine that a lot of folks initially want to tell someone why that might not be the case, right? I want to share with you why it's not the case that you're going to get COVID from getting the vaccine. And when we do that, we naturally fall into this place of being a director. And so this slide really shows you the different places that we can fall in our communication styles. Director meaning I like to take the lead. I like to tell people what to do. I really like to manage the situation. Versus the follower is more so I'm listening. I'm doing a lot more listening than I am talking. And this I always like to think about as, this is the really good friend. You know, they're there, they're hearing you, they're hearing your story, but not necessarily jumping in, you know, in the middle of that story. And then the guide is right there in the middle. It's like the guide you would imagine when you're on a trip and they are guiding you through this new experience, but they're also letting you experience this as you go. And so the reason we like to pause here and talk a little bit about this is because it is important that you recognize your own natural communication style. And if you naturally fall into a director role, part of this path is to bring it back and remind yourself, I'm here to be a guide. Motivational interviewing is here to be a guide. I want to guide this person to a place. I want to find that motivation from within them and pull that out and guide them to a place of change. Because what we know is that when we fall into the director role, we often lead patients to feeling frustrated, maybe even it's counterproductive to what we hope. They might feel powerless in their own care at that point.
And I think, Kelly, about the communication styles, when an individual is, when a clinician, any person thinking in this role as the helper, right? Anyone who is either feeling a lot of stress or facing a situation that is very important to them or that they have strong feelings about, but particularly if you're stressed, you're very likely to just fall into your default natural communication style. And the more urgent something feels to you, the more likely that you're going to, if you're a director, that you're going to just easily go to that default director style. Or if you're a follower, that you're going to fall to that part of not of avoiding challenging or difficult conversations. And so this is where, again, like you said, it's really helpful and important to know what your default is. It's not to say that any of these are naturally bad. They just are not motivational interviewing, and there are situations where they're not the best go-to.
Absolutely. And, you know, we find that when we're in time sensitive or we're under time pressure, we naturally also kind of fall back into that communication style that is natural for us. And director is where I see people in healthcare fall the most. When we're in this place where things are time sensitive, we're in a pandemic right now. We all would love to see the end of this. And there's this sense of urgency, right? If we all could just do this, then we'll get to the end of it. And when that happens, and when we feel that inside us, and our helper inside us says everything about, I need to tell you why that's wrong. I need to tell you that this isn't the case. And this is what will happen if you were to get vaccinated. And it comes from a good place. It comes from, you know, a heart of wanting to heal. And yet the outcome is not what we hope it will be. And that's really where we get to the conversation about the roadblocks. Julie's going to walk us through some of these roadblocks that we often find when we're trying to do the right thing.
Right. And I think when you look at these, you know, these lists of roadblocks, some of them feel so obvious, like threatening and shaming. You know, those are like, of course, that like no good professional would be doing those sort of things. I think sometimes we can fall on the lecturing side when we think we're not, but I think that's an easy one to fall into. And, you know, but also like we just talked about, if you're giving advice that's unsolicited, if you're providing solutions without including the person, you know, and you just, well, this is how you should do it, or you start to make the plan without really involving the person, those are really roadblocks. And when you are doing these things, you're not listening. And at the heart of this is, you know, really listening well to understand that person and their beliefs, their concerns, their perspective. And so, even though some of these things on the list, some of them might seem very troubling, some of them don't seem that bad to somebody necessarily, but what they are not listening, and they are roadblocks to that sort of partnership and collaborative kind of conversation and planning together. So if you're doing these things, you're not listening well, and they are roadblocks to those good conversations. Along with praising, it is one of those things that's really sort of brings in a hierarchy, right? It puts me above, like what you did is good because I'm happy with it. So, thinking of some of those things, like why would praising and giving advice be roadblocks? Those are some of the reasons why things like that are roadblocks in this scenario.
Roadblocks to that own individual's movement towards change. We
Right.
have our own ideas in our head as to why someone else should change, but it's not about us, right? It's about
Right.
their life, their world, and their change. And I think that's the part that sometimes can be one of the big roadblocks. Julie and I were talking earlier about, when we view things as a public health initiative, when we view things as this is what's best for the greater good, and yet this is the individual person in front of us, and it's their choice, it's their world and their life, and we're not there to make that choice for them. And so that's where I think giving advice and providing solutions can really trip up the conversation. And so we do we try to be interactive, and I know this is a recording, so here we maybe we'll pause, let you kind of look at these and see if you can identify what and why these might be roadblocks, and we can read them out loud as we go. And so this first one says, you should get this vaccine to better protect your family. Now, where again, this might be true, right? This might be a valid point. When we say something like this to someone, this is we're giving them a reason, right? They're not giving us their own personal reason, but we're giving them something that might not be something they've thought about, or it might not be of value to them. The next one, so that would be a roadblock.
Right. And that can feel like moralizing and judging, right? Like you should
Absolutely.
do this. So if you don't, it means you don't care about your family.
Yep.
Right.
Yep. Absolutely. Which of course is not the case. And when we give that perception, we're going to lose that connection with that person. The next one, the best way to end this pandemic is for everyone to get vaccinated. And again, this kind of gives that same feeling of, well, if I'm not going to do this, then I'm not a part of the solution. And so I must be bad. I must be doing something wrong. And we don't ever want to give to put a patient in or a client in a position of feeling less than. The next one is, you have too many health risks to not get vaccinated. And I've actually heard this a few times from some well-intentioned providers. And I think it comes from a place of, I care about you. I want you to get through this. I don't want you to get sick. I don't want you to become hospitalized from COVID complications. So you got to get this. And so again, it's from a good place, but it's a roadblock, because we're trying to insert our own ideas and values and hopes, and we're not pulling from them. What are their own hopes and fears and worries about getting vaccinated? And then of course, the last one is intended to not be a roadblock. This is, tell me more information. Anytime we're opening up that line of questioning, tell me about your concerns that you have. We're eliciting, we're asking, we want to learn more about your story and where you're sitting with all of this.
A lot of the stuff that we've just talked about really leads right into this conversation about something that in motivational interviewing we call the writing reflex, which is really this, as helpers in our heart, we want to help people. We want to help people move toward positive change. We want to help people stay healthy, and we just feel called to do this, which is a good thing. At the same time, we can then, that overwhelming feeling we have to try to persuade this person to do the thing that we know is going to be the most helpful to them. We can then deliver that our message. We can approach them in a way that falls into the writing reflex. That then, think about going back to a few slides ago when we were talking about how normal it is to feel ambivalent and to kind of feel two ways, and think about a time that you had sort of mixed feelings, and then someone came to you with a very well, let me tell you what you should do. your natural go-to is to, defend that side that doesn't want to change. And so we don't want to set up this dynamic with folks where, they might be feeling two ways about it. They have some mixed feelings. They don't want to get sick, and they have fears or concerns about the vaccine or distrust about things, and if we push real hard on the one side, the natural human reaction is for that person then to defend the other side. And we've almost set it up where we're making it less likely that the person is going to make this choice by us sort of backing them into a corner, even though it's coming from a place of caring on our part, that when we fall into this writing reflex of trying to convince people, giving people the reasons, then we set up this opportunity for them to argue back with us instead of, just having this really open conversation about sharing information. What do they know? What are their concerns? What would be helpful? So yeah, so all these slides really fit together well. And the writing reflex is kind of the term that we use that kind of pulls all of this together. And when you notice that urge in yourself to jump in and try to convince somebody, that urge in yourself to fix the problem, oh, it's so obvious for me, I can see so clearly what the answer is, and let me just get this person to do it this way because I know it will help them and I care that they get help. When you feel that urge, that pull to jump in like that, be cautious, because it's likely your writing reflex, kind of that itch that you get to jump in that way.
Suppress it as much as you can. And, the research shows us that the more people talk about not changing, the less likely it is they'll change. The more people talk about change, the more likely it is they will. So we want to draw that change talk as much as we can. So that's what we're listening for as we are trying to suppress that writing reflex. We want to try to pull out and hear more of that change talk, the reasons to move on that pendulum. So Julie and I want to go through a quick example, and we don't want to spend too much time on here, but we want you to kind of hear what this might look like if we were to fall into a director role specifically surrounding a conversation with getting vaccinated. So I'm going to start off as the clinician and roll right into this example. Hi, Julie. I know we're talking about getting the vaccine, and it sounds like you don't want to get the COVID-19 vaccine.
Yeah, I'm really not sure. Like, I feel like I should get it, but I'm really worried. I'm not sure that we really know it's safe.
Yeah, there's no reason to be worried about efficacy. The vaccine has been put through clinical trials. It's completely safe. There's absolutely no reason to be worried. Even I actually got it.
Well, Dr. Gable, I've done some of my own research, and I believe that you believe that, but I don't really think that's the whole picture.
Yeah, well, I want to remind you, I'm a pharmacist. I'm really familiar with the research on COVID-19 vaccine. I've looked at it for hours. And in fact, a recent peer-reviewed study showed that there's very little risk of negative side effects. So, I think that it's really important that you think about getting it today.
Yeah, well, I'm still just not sure. And I believe that you believe what you're saying, but I need some more information. I'm not sure.
So you could clearly almost probably feel the tension in that, right? And of course, I'm saying things that feel real to me, right? As the clinician, I'm saying things, I probably have spent hours researching this. And I want them to know, look, trust me, I got this. It's safe, I promise you. And yet what I'm doing as I continue to push, it felt like I was pushing and pushing. The patient or Julie, she's saying, no, listen, I want you to hear me out. I'm telling you, I'm not there. I have concerns. And not once did I jump in and ask her, what are those concerns that you're having? And so I stayed steadfast in that director role. And part of it might be, I've got 5 minutes with her. I got 5 minutes. This is what we're going to talk about. And that's my time pressure that says, I got to get this out. I've got to say this. And yet that 5 minutes, or even just right now, we only spent a few minutes, less than a minute probably on that. And it wasn't a successful interaction. It didn't feel well for either party.
Right. And it probably left me as the patient certainly not more likely to get it, maybe even less likely to get it,
Yeah.
right?
Yeah,
And I hear that
absolutely.
too a lot from people when they come back and have conversations with clients that they didn't feel like went well. And I hear them say, well, but I needed to make sure that I told them
Mhm.
blah, blah,
Yeah,
blah.
yeah,
And
absolutely.
it's like, well, then you met your needs, but you didn't necessarily help the
Yeah,
person.
right. And in the end, yeah, it's like it ends up being a negative interaction for both people. And that's unfortunate. And I know that's not what any of us want.
Right.
So this is where we want to change the energy in the talk, because we want to pause, we want to reflect upon what we've just reviewed, shift our focus, because now we're going to talk about the true motivation from within each person and how we can start to listen for and respond to change talk. And this is really where we hope to see the building of trust and hope and healing in our communities as we move forward. So as we said, the true motivation to do any change when we're ambivalent really comes from within each person. And we try really hard to sometimes say, I'm gonna give you all these reasons to change, all these motivations, but the true motivation is within each person. And it can fluctuate. And so you might have a conversation with someone on Tuesday about getting vaccinated, and their motivation may fluctuate by Thursday, or maybe even in 15 minutes in that session with you. And so it can vacillate between conflicting ideas in my own head about it. It can falter in response to doubts I have, or it can strengthen when I feel like I'm empowered in that conversation. But it belongs to that one person. It can be influenced by outside factors, by the world around me, the people around me, my family, my friends, but it's also very much influenced by the interaction I have with my clinician or provider in the room. And so the takeaway there is that your communication style matters. It very much matters in terms of how my motivation may shift in a conversation. So we want to spend just a little bit of time going through the spirit of motivational interviewing here.
And so the first element of spirit is partnership. So really that really speaks to this just profound respect for the other person, and that we are working on this together, that we are sort of co-equal partners that each bring different expertise. And in a medical setting, you bring your expertise on the medicine, and the person you're serving, your patient, brings the expertise on themselves and their values and their life. And so if you're going to work together with your patient, you have to have this partnership that blends your expertise on the medical part and their expertise on themselves and their lives and how this fits into their life.
And as we're walking through these, you can see we've got some quotes on the side that we may recite as well, but these are examples for you. If you're thinking about how can I shine a light on one of these aspects of the spirit, these are some ways that you might do that in your conversations. The next part of the spirit is acceptance. And acceptance is, I think, I found in my years of work for healthcare clinicians, this is where people struggle sometimes the most. And this is that acceptance that each individual, each patient or client in front of us, they have their own ability to make choices for themselves, respecting their autonomy and whatever choice they make, and that it may be different than what we might choose, that we might choose for ourselves or for them. So accepting that they get to make the choice at the end of the day. It's their life, it's their world. When they leave that session with us, they enter back into all the different challenges and beautiful things happening in their world. So some of the quotes that we put up here, I think are really important. If at all in your session, you can just throw out there in a genuine way, in the end, the choice is yours. You get to decide if you're going to get vaccinated. I don't want to put more pressure on you. I want you to know that at the end of the day, I'm here to support you, and it's up to you. And that's an important thing to convey to someone.
And then the next element is compassion, which is, really about, as we interact with the people we serve, that we need to always prioritize what is in their best interest. And it's challenging because it's so complicated. It's not just one thing, right? And this is where things overlap a lot, right? But we may really feel like what's in their best interest is to get this treatment or get this vaccine so they have the best chance of staying well. And we're very focused on that element of it. And they may be considering it in light of a variety of other things. This is where, really understanding our motivations and that person's motivations, and giving priority to what is in their best interest over our motivations, and also really seeking to have that empathy of really understanding what is this person's point of view, how do they see it, what in this is meaningful to them. And so that real sense of empathy, of trying to understand who they are and what this means to them and how it fits in for them. And so really statements that highlight how we understand and how we care, and how we're not just trying to push our thoughts and beliefs on them. So things like, I can see that this is a really difficult decision for you. And, if it feels like people aren't understanding your struggles. Those are things that, delivered in a genuine way can really give someone the opportunity to stop and think about things.
Mhm. And then finally, the fourth part is evocation. And that's really the heart of MI. It's evoking from within that person in front of us their own true motivations for change. And so when you try to make this specific to getting vaccinated for COVID-19, some questions that you might consider asking that might be evocative questions. How do you see this pandemic ending? And that's really more so how they view it from their world. Um, Tell me about some health concerns you have about yourself, or what's important to you. And then, of course, if you know that someone's gotten a vaccine in the past for other things like influenza, maybe asking about that. I know that you've done this one in the past. I wonder, what motivated you to get that? So you can start to see and learn for yourself. I mean, it's about keeping your eyes and your ears open and learning from their perspective. What are their worries and fears? And so this next part is really diving into the skills. Julie's going to talk a little bit more about skills and reflections.
And so when we're thinking about motivational interviewing, these are the skills, and I'll talk about them in just a second. And we want to be sure that the skills that we deliver are always delivered in service of the spirit. So these are not skills that happen in a vacuum outside of the spirit. They're skills that we use in service of the spirit, and that are help us carry out the spirit, not just because you can ask lots of open questions that are not in the spirit. We want to ask open-ended questions versus just those yes or no questions, or those very seeking a very narrow answer. Open-ended questions, we get more information, and it also sends a message to the person that we are working with that we're genuinely interested in them. We're not just trying to gather the information we want to get. We're genuinely interested and curious, and we want to understand this person better. So open-ended questions are very useful ways, very helpful way of engaging with people. Affirmations are really about identifying, seeing strengths in a person, and making a clear statement of that strength that we observed. So even that person that is saying something that we disagree with, thinking about the conversation with Kelly and I when I was the patient, an affirmation could be, you really thought about this and have put in some work to look into it. This matters a lot to you. So an affirmation, identifying a strength that you see in a person that you serve, and making a direct statement where you are affirming that strength to that person. And then reflective listening is really a core skill in motivational interviewing and it shows to the person that you're serving that you really understand them. It's that sense of empathy that, like, oh my gosh, Kelly made this reflection, and it yeah, she gets me. Like it's it's true. She understands, she's listening, she cares, and she gets me. It also gives me the opportunity to hear back what I said. And sometimes you might hear back what you said, and it helps you understand yourself better. That, when if Kelly would make a reflection on something I said, it might help me understand myself better, and it might help me understand some of what I said and how it came across, and like, oh yeah, that is what I said. And now that I hear it back, I don't think that maybe that's not exactly what I mean, or maybe I really do think something different. So it gives me, while it gives Kelly the opportunity to demonstrate to me that she really gets me and understands me and has put in the effort to care about what I mean and show me. But it also gives me a chance to understand myself better. When someone really does effective reflective listening to me, I understand myself better. And then summarizing, which is pulling together, and this is, as we talked about, the communication styles, summarizing is a really clear opportunity. All these skills are, but in summaries, we really get that opportunity to be a good guide, because we're very thoughtful about what it is we include in that summary, and thinking about what are the strengths this person has, and what are the reasons this person has presented themselves about why they might want to make a change. And we can kind of, in a nice package, present that back to that person in a summary. And when you hear those statements, maybe that you made over a 15-minute conversation, when you hear some of those things that you said at the beginning and at the middle and something at the end pulled together, you realize maybe that there's a lot more there than it felt like when they were all just sort of dispersed throughout the conversation. So those, really quick, those are what the ORs are, some of the micro skills that we use in motivational interviewing. And then again, reflective listening, which I already talked about probably a little too long, but is a core, really important skill. And it's one of the more challenging skills to do. It is much easier to ask questions than it is to reflect well. And so when we are reflecting, it's our hypothesis. We're making a guess at what the person means, so that we can be sure we really understand well. And so like I said, it gives them that chance to hear back what they've said. It reduces the likelihood of resistance. Sometimes doing it as a reflection gives the opportunity for it to just, the conversation to flow, versus sometimes that same piece of information as a question can feel a little more like somebody can be taken aback. Like if I say to Kelly, you're feeling a little worried about this vaccine. That's a reflection. If I say, you're worried about it, that's like almost the same words, but it feels very different.
Yeah.
And so, just seeing how reflections work differently, and they can provide a lot of power in the relationship and in the engagement with the people that you're serving, and give people the opportunity to clarify. We can clarify what they mean, and the person can clarify in their own mind what they mean. And then, there's the more complex reflections, are those things that really go beyond what the person has said. Sometimes in motivational interviewing, we talk a lot about what the person says is the tip of the iceberg. And then we all know that there's, the water line, and most of the iceberg is actually below the water. And that's the really big stuff. And that when we can do some reflections that really get at the iceberg, what's below the waterline, it can add so much more meaning, and it can really help the person then sometimes really think about what that means for them. That might be deeper than, just the words they said, even though the words they said are true, right?
Yeah, I wanted to pull this up while you were sharing that, because I think as people try to kind of navigate reflecting, and we want you to try to think about more complex reflections. Simple reflections can be all right, but I always kind of call them, they're the filler in the conversation. It's like a head nod, right? I hear you, I'm with you, but the complex reflections really go deeper underneath that iceberg, right? And so if you look at some of these statements from patients on this slide, really what we want you to do is think about what are they trying to tell me? Always in my head, when someone responds in a certain way, I'm thinking in my head, what is it that they're trying to share with me? That's my reflection back, right? And so some of these examples are things like, if a patient says, I'm scared to get this vaccine, I don't want to get sick. What are they trying to tell us, right? In my mind, I'm thinking they're worried that the vaccine is going to make them sick. They're worried about side effects that they might get. And then another way to say that is, you really care about your health. You care so much about your health. You have fears about getting sick. And they're going to give us more information, right? If we don't get it fully right, they're going to tell us. They're going to say, well, it's actually more about, I've got to work. I've got to work every day. I can't afford to be off of work. I can't afford to be sick. And then we can continue to hear, reflect, and move that conversation.
And we can see, but you can see here, if a client says, or a patient says, I'm scared to get this vaccine, I don't want to get sick, the pull to the writing reflex of saying like, oh, let me explain to you how vaccines work, because this will not give you COVID. And that then we've fallen right into the writing reflex. The person is probably shut down a little bit, versus saying, you're concerned about your health, and then the person responds. And like we said, it might take us down that road where we can really discuss that. And, we might've been assuming it's one thing, and that person's like, I know 3 people who got it. And boy, after that second shot, they were sick as a dog and missed 3 days of work. And I can't do that. And I just would rather take my chances, because so far I haven't gotten it, so now we know what it's about, and we can really explore that better with them, right?
I love it. We're always learning. I think the second one, we're going to pull up some that we have gotten from clinics in the field as well. But the second one is a must to validate, right? And that's some of the core of what we're going to talk about at the end of our time together. But this distrust that many have within our healthcare system, and it's a valid distrust that people have based on their own experiences, based on family or friends' experiences. And so when we hear things like, maybe it's overt, I don't trust anything from the government right now. Maybe it's overt, or maybe it's they're telling us in some way, I can't trust the process, right? And so it is really important that we validate whatever where that feeling, and reflect upon it. You've had some negative experiences in the past, and you're really worried about whether or not this is going to be safe for you, right? In some way, can we pull that together in our reflection back to them to let them know, I hear you, right? I hear you, I see you. Let's talk deeper about this. So I want to pull up too, while Julie and I are talking about these, because you'll have these examples for you, some examples that we heard from clinicians, and I'll try to make this a little bit bigger. And we will try to respond to some of these so you can kind of gauge some reflections that you might be able to pull from these. So we'll start up here, and I'll let Julie start us off, and we'll just kind of go through some of these together.
Okay, so person says it was rushed. So you're really concerned that we don't know enough about it yet.
I won't need the vaccine when everyone else gets it. So you're worried, or you're wondering about how many people really need to get vaccinated for there to be some sort of herd immunity, and you're not so sure that you need to be a part of that process.
And I'm healthy anyway. This fits well with what Kelly just said. I'm healthy anyway. I don't need it. And I can see how it could be easy to get pulled to that writing reflex of explaining, like, well, we need healthy people to get it because there's asymptomatic cases, and and we need herd immunity, and so it's easy to fall into that writing reflex, and instead reflecting of it, it doesn't feel to you like a priority to do this right now.
Let other people take the vaccine. So what I'm hearing here is you'd like to see how other people, where you're ready to get it. So you're a little worried about safety or how effective it is. You want to kind of see what happens to other people first.
You'll get sick from it. You're worried about your health, and you're just not confident yet.
Yeah. And there's another one here. I mean, you're going to hear this a lot. I'm imagining as you're talking to people, if I get the vaccine, will I get COVID? I've heard people say, well, I know a family member who got sick after they got the vaccine. And again, our writing reflex is to jump in there and explain to them how this vaccine works. But really, we want to make sure that we're letting them know, I hear you. I'm not here to right that wrong, right? And so what I'm hearing from you is you do really care about your health. You're really worried about getting sick. You're not so sure. Is it possible to get COVID from taking this vaccine? And I will tell you, we're going to get to this, but there is a place for you to offer up information. There's a place to do that. And we just want to make sure that we do it in an MI consistent way that honors that person's autonomy and that we hear them first. We really want to hear their worries and their concerns first.
I don't want to be tested on with this vaccine. So you're feeling worried that it's still sort of in an experimental stage, and you're afraid to get it till you're confident that we know everything we can know.
I'm seeing some common themes here, right?
Yeah.
And this is where you're going to hear, and this is where I think it's important for you to really practice and think about in your own style, how might you respond to these? Because we're seeing the common theme of it was developed too fast. And oh yeah, having to drive a long ways to get it, or having to jump through hoops to get it. And I know that people have had that experience. This has been a really hard or stressful experience for you, and it hasn't been easy. And so validating that, reflecting upon it, and then how can we move to the next part of the conversation, which might be, would it be okay if I share with you some things that have popped up in the community in terms of being able to get vaccinated? So let's pop back over to the slides and talk a little bit more about the difficult conversations. So these, I think, are going to become more common as we dive a little bit deeper into how long the vaccines are available. And so we're going to start off. So hi, Julie, I'm calling to let you know that you're now eligible to get your COVID-19 vaccine. Would you be interested in learning a little bit more?
No, I'm not interested. Absolutely not.
Okay, yeah. It sounds like you've got some concerns. Would you be willing to tell me a little bit more about that?
Yeah, I just am worried. I feel like everybody's just like pushing it on people, and like that makes me, I already have some like trust issues. Like I don't trust the government. I don't trust the big pharmacy companies, and now it's just being like pushed on us, and it makes me more uncomfortable about it. So yeah, I'm not sure it's safe, and I don't like being like pushed.
Yeah. You've had a lot of not so good experiences in the past in healthcare in particular, it sounds like. And it sounds like you're getting some push from all around, like other people have tried to push you into this too. And so I don't want to be another one of those individuals that's pushing you to feel uncomfortable. And I really appreciate you being honest and open with me. In the end, what you decide to do, if you decide to get vaccinated or not, it's your choice. And I want you to know I'm here if you ever have questions, if you want to chat about it, but absolutely your choice to make. Okay.
Okay. Yeah. Well, that feels better.
Mm-hmm. Well, I wonder if, I don't want to take up too much of your time. I wonder if it'd be okay if maybe I just check in a couple weeks and just give you a call and see how things are going. And if you have any questions, I could answer them.
Yeah, that feels okay. I mean, I would, since you're not like just pushing it on me, and I'm still not sure, but I would be willing to talk to you in a couple weeks.
Awesome. I appreciate that. So I'll give you a call and we can chat a little bit more and see how things are going.
Okay. All right. Thanks.
So when we walked through this one, these are not easy conversations to have. And I think if you're making phone calls, you're going to get some hard no's. out of the gates. And I think sometimes I've heard people say, I don't even know what to say after that. There's this pause, there's this awkward silence on the phone after somebody gives me that hard no. And so at this point, again, we're just honoring what they've told us. You're feeling the pressure. People are putting pressure on you. I don't want to be that person. I'm here for you to be a support. And so just in a genuine way, let them know, respect what they've told you, that they're saying no right now, but let them know that you're here as a resource. And so, there's some other statements that we've got on the slide that you can kind of play around with, do it in your own fashion, right? This does not have to be a script. And when it feels scripted, it's not going to be genuine, but we want you to take these sentences and kind of, put them into your own language when you're talking to folks. And you'll get your rhythm and figure out what works for you. Other things that you'd add here, Julie?
No, I think that, yeah, like what you said, Kelly, it's so easy to fall into the writing reflex or to just be like, drop it. And what's that in between point? Because our goal with all of this is for staff to feel more comfortable and confident in these conversations, and that even if the answer is no, like to help people come to the right decision for them and to maintain a good therapeutic relationship with people, so that in the end, if people are still not going to get the vaccine, they can either still not get the vaccine and be even more angry with us and cut off and decrease the chance that we can be helpful to them moving forward on this or other health issues. Or, maybe they will end up changing their mind and getting it, or maybe they'll still say no and not get it, but they feel respected. This relationship is intact and in some ways maybe even strengthened, and it increases the chances that they will, because this is not the only role that we have in people's lives. And we want to set up this environment that we're always talking to people about challenging, difficult things.
Yeah.
And we want this to be a relationship that's safe to come back to, and that they want to come back to, and that they feel respected in, and that opens up the chance that we'll have more likelihood to be helpful to them in the future on this and other issues.
Absolutely. Absolutely. Because the conversations don't end here. I mean, we want to be able to re-engage this person, to have another conversation with them. It doesn't just end with this one phone call. And, I've had these conversations a bunch on the phone and in person, and I've had plenty of people start out of the gate with a no, I'm not interested. And by the end of the conversation, they're willing to hear a little bit more information, and even some of them ready to sign up on the wait list. And so these conversations, they do matter, and it's not hours of conversation, it's minutes of hearing and listening. And really, I think expressing the words, it's your choice. Right. It's in the end, it's your decision what you do, because so many times people feel that pressure from all around them, from media, from family, from, providers in their life. And so to really just respect that, that in the end, I'm not here to pressure you, it's your choice.
And the difference as a patient, feeling like somebody's just trying to convince me to do what they want me to do, and somebody has really heard me and respects me.
Yeah. Absolutely. So we want to close out the last part of this talking a little bit more about distrust in our healthcare system. And we think that this is really important because people over the years have developed a distrust of our healthcare system for many reasons, and for very valid reasons. People in minoritized groups in particular have a long history of exploitation within the healthcare system. And there's lots of examples that demonstrate that. And we see the continuation of racism within our healthcare system that plays out in infant mortality and maternal deaths in our Black community, in opioid overdose deaths that we see in our African-American community, in Hispanic communities. And so people have a right and a reason to have distrust. And it is important that we honor that, and we do not diminish that, and we bring light to it, and we talk about it. We don't sweep it under the rug, but we talk about it. And that's a part of the healing process. And so this next slide really talks about how we can start to build trust back this is not going to happen overnight. And it's certainly, it's a challenge within a pandemic. It's a syndemic that we are faced, the racism within our healthcare system on top of the COVID-19 pandemic. And we have to address both. We simply have to address both. And so some things that we can do as healthcare clinicians, as caseworkers in our system, acknowledge and validate, acknowledge the harms that have been done, discuss them openly with your patient or your client without lecturing. And my favorite thing in this entire piece is listening to understand. And Julie mentioned this at the beginning of the talk as well, not just listening, but listening to understand what that person's story is, what their life has been like, what their experience has been like. And then always keeping patient autonomy first, which we've shared a lot here today. It's clearly really important that ultimately it's their decision. And the last part, the takeaway or the final piece to this is how can you give information? So I'm going to let Julie talk a little bit more about how this goes.
Right. And so now we are getting to the part where you can maintain an adherence to the spirit of motivational interviewing and still find opportunities to give advice. And it follows this rhythm of asking first for permission to give advice, and or asking people what they already know, right? So, or what their concerns are, instead of assuming. I don't assume and jump in and tell somebody information based on what I think their concern or worry is, or I don't assume that someone, like in that previous scenario where I, as a patient, said, I've done some research. Don't just jump in and assume the person doesn't know anything. Ask first, what questions do you have? What would help you? What would be important information to you to have, to be in the best position that you can be in to make this decision, instead of me deciding this is Kelly, what you need to know to make this decision. What's important to you, Kelly, to know as you make this decision? What do you feel like are the gaps in the knowledge that you have? What concerns do you have about this? And then find out from the person, and then with that offer of information, so can I share with you some things about, if that's great that you've done research and you've gotten some information from this site, is it okay if I share with you some additional sites to get some more information? And when you offer it small bits, right? Small bits of information. So as soon as the person says, yeah, you can tell me, then you don't want to dump everything on them at once, right? Oh, here's my chance to push out all the information I want. You want to put out small amounts of information that you've gotten permission to give them, and then follow up with, how does that make sense to you? Or what do you make of that? Or how do you feel about that? So, that ask, offer, ask is that sort of a rhythm to being able to provide advice or information in a way that is MI adherent. And then if you ask, can I share with you? Are you interested in hearing? And the person says no, then you respect that and you don't push forward and go on. And you say, okay, that's fine. If you decide later you want to know something, let me know. I'd be happy to share something with you. But I will say almost always in my experience as a social worker, almost always when you genuinely and respectfully ask somebody, almost always they will say yes. That doesn't mean almost always they'll take your advice, but almost always they'll be open to hearing what you have to say, because the way that you offer it is in a way that's genuinely respectful of their autonomy. But if on those rare times when people do say no, you need to really honor that and respect that and say okay, thank you for telling me, and drop it.
It's an opportunity to reflect too, right? You're not in a place right now where you want to hear more about this, right? And that's okay. And so reflecting upon what they're really trying to tell you. One of the things that I think is so critical in this ask, offer, ask, and some people may call it elicit, provide, elicit, is that in that offer part that you are asking permission first. And I know for some, I tell you practice it, because it can feel for some a little awkward to say that. But it's the respect of one's autonomy to say, would it be okay if I share this with you? And they have the right to say no. And so giving people choices is really important. And when you do give information, giving people choices there as well is also really important. So we have a list of resources here. There are so many other resources that you could tap into. We just pulled a few to put on here. Locally in our St. Louis community, we really appreciate Prepare STL. There is a whole host of information on here. And there's specific Q&As for COVID-19 vaccine and testing. So check it out. If you're in our local Missouri area, Stronger Together is another great resource. If you're interested in motivational interviewing, you can always go to the Mint website first. There's lots of other resources out there beyond that, but it's a good place to start. And of course, if you have questions for Julie and I, we will have our email contacts that you can reach us at as well.
Yeah, absolutely.
So we thank you for your time and wish you good luck as you have these hopefully successful and sometimes challenging conversations with the people that you care with.
Absolutely. Yeah. Best of luck. And thank you, Kelly, for inviting me to be part of this.
Absolutely.
Hey, good morning, Vashon. I was hoping to talk to you today about your thoughts on getting the COVID-19 vaccine.
Good morning, Joe, but I'm not interested in a vaccine at all.
Okay. Sounds like you have some real reservations. Would it be all right to talk about some of your concerns?
Well, that would be great, but I saw something on one of my friends' Facebook posts, and they were saying that that vaccine can't be trusted. So I'm not too keen about wanting to get it. So if it's FDA approved, then that's be good, but not to mention the healthcare system has a poor track record with the Black community. So therefore, I don't know if I can ever trust that.
Right. So you're feeling pretty conflicted about the safety of the vaccine and additionally the transparency from the government, even some of your healthcare providers.
Yes, exactly. So how am I supposed to trust the vaccine when we really don't know what it contains or what it doesn't contain or if it's even dangerous? So for me to receive it, not everybody can, bodies can accept the vaccination.
Right. So you'd really like to be sure that this is safe for you. Yeah, I understand that. Would you feel comfortable if I shared some more information with you about the vaccines?
Yeah, sure. Go ahead.
Okay, thanks. So first, you're correct. This process did happen pretty quickly. The safety and effectiveness data that we have is from thousands of volunteers, and it has been reviewed by the FDA. That data has led to the vaccines being available under what is known as emergency use authorization. The emergency use allows the FDA to approve the vaccine quickly in response to a public health emergency.
Well, I see, that makes sense, but I still don't know if the government is looking out for me as a minority. So I don't know.
Right. Yeah, you're finding it difficult to trust the process because of some experiences you have and some historical events that have also happened regarding the Black community. So I want to be as transparent as possible, and I want you to know that the decision to get vaccinated, that's always going to be your decision.
Well, I appreciate you telling me that, and I've thought a lot about this vaccine, and I'm also still really worried about it at this time and worried about the side effects.
Right. I appreciate how much thought you've put into this already and thinking about the potential side effects. That still worries you. What are you most concerned about regarding that?
My thing is the side effects, how long the side effects will last. And I think I might be more open to vaccines after more people have taken it. I'm just leery of it. So I want to see how other people react to it.
Right. Well, I'd be happy to share a bit more information about the side effects that we have seen so far in the people who have received it. Would that be helpful?
Okay, cool. Yeah.
Great. So after the first dose, many people have reported some muscle soreness at the injection site. The second dose can have some stronger side effects like fever, body aches, and fatigue that typically last for a day or two. We're still learning about the long-term effects of the vaccines, but the information we're getting is really positive. I can share my own experience. I had kind of low-grade headache for about a day, just over a day after getting the second dose. How do you feel about that information?
I mean, those side effects does seem meaningful. I definitely think I like to like more information before taking or making my decisions, making and thinking my decisions through.
Yeah, I get it. I gave you a lot of information to think about and don't want you to feel rushed into making a decision. So I'd be happy to provide you with some handouts you can take with you. You can look at those, and then if you'd like, you can come back to have another conversation with me in about a month or so.
Yeah, I appreciate that. Thank you so much, Doc. That'll work for me.
Yeah, thanks for sharing your thoughts and opening up. I appreciate you engaging in this conversation with me.
Yeah, thank you.
All right, take care.
You too. Bye-bye.